I just wanted to, in this little brief presentation, talk about the work that we're doing at the ESD Association to try to provide some guidance to the healthcare environment. We've done a lot of work as an organization in the past to describe the hazards and things you can do about controlling those hazards in the electronics industry. But in the healthcare industry, it's kind of a new playing field, and it's a very uncontrolled environment in that, it's not a factory where you can control what goes on and who goes in and out of the areas. And in a healthcare environment, you have, visitors, patients, doctors. So it's a very uncontrolled environment, and the risks are different. So in this talk, we'll just talk about what those risks are. And again, they're different than what you would find in an electronics manufacturing environment. So the first risk, which is kind of obvious, is shocks to personnel. I should start by saying, in an uncontrolled environment, you can have shocks that range anywhere, from a few hundred volts to tens of thousands of volts. You would feel a shock at something over about 3,000 volts. So in an electronics environment, you can damage circuits under 100 volts. So this is a very different environment. Shocks to personnel, again, you would feel it something over 3,000 volts. And if somebody gets a shock where they feel it, obviously it's discomforting, but it could actually impact a doctor's application of a procedure. Their hand could move, or even in a surgery, which would be pretty devastating. So it seems simple. Oh, I get shocks all the time in the wintertime, but in a healthcare environment, that can be a problem. So that's one risk that exists, and it's a real risk. The second risk is disruption and loss of function to medical devices, and this is the kind of thing where a packaged medical device has a much higher risk tolerance than an individual circuit, but still it has a risk. So typically, again, something over a few thousand volts could disrupt the way the device works. Might not damage it, but the data might be corrupted. It might give you an incorrect reading. And there was a study done with out of some FDA data where they looked at malfunctions of medical devices that were attributed to static events, static discharge events, and there were a lot of them. So, and some of them had some serious consequences. So this is a real issue. And again, in a healthcare setting, because the devices are already packaged, they aren't as sensitive as when you're making a circuit board or making the device itself, but they are at risk. And if we can control the static discharges to those to under a couple thousand volts, then you can prevent or significantly reduce the occurrence of these types of failures. The third one is disruption and loss of data. And, in the healthcare environment today, everything, all the data is now being captured. It's transmitted from device, from where it's measured or monitored, to the doctor's office, to the computers. It's got to be protected for one thing, but from a sensitivity standpoint. But the data itself can be corrupted due to static discharges. There have been cases where when someone has a tablet that they've used, say in a room, and they bring it back to the docking station, that there's a discharge and the data gets corrupted, and you sort of have to redo the procedure, and it's not a comforting thing. So it is, again, it's another real risk that has to be protected against. This last one, next one is a sort of a goofy picture, but it makes the point. I mean, this is a picture of a cat with little packaging squigglies stuck to it from static. In a healthcare environment, picture the cat as being a person, picture the little squigglies as being germs. And it's been shown that having a highly charged or even a charged body in an environment leads to the higher attraction of germ particles to the body. It also leads to the higher attraction of germ particles to surfaces. So it becomes a little harder to keep areas and people germ-free. And, this can lead to hospital or healthcare facility acquired infections. I don't think there's been real studies of making a one-to-one correlation, but it is known that by reducing static, you can reduce the occurrence of the electrostatic attraction of particles to people and to surfaces. There was a study done where they showed that the occurrence of these types of infections and secondary effects is less in more humid conditions. which is interesting because in those more humid conditions, there is less static. The higher the humidity generally, the lower the static that builds up. So there has been some secondary correlations made where the effect was theorized to be from lower static. So higher humidity, lower static, lower occurrence of these types of infections. And then the last one, which is really where in the healthcare environment, this issue really doesn't exist very much anymore, but ignition of flammables. A long time ago, anesthetics were flammable. And this is really where the control of static electricity in the healthcare environment began. But since this risk really has been minimized and in many cases eliminated, the discussions, the standards, the guidelines that used to exist for the control of flammables in healthcare doesn't include the control of static to control the risk of ignition of flammables. So, it used to exist, this guidance, now it doesn't. So in what we're doing as an organization is we will include a discussion on this and what can be done about it. So those are the primary risks that exist in a healthcare facility for static discharge. Like I said, several of these are, they can present serious health effects. And one of the things we're doing in our working group as we address this document is we're trying to align with what the goals of a healthcare environment are. And, they abide in the construction or the building of a healthcare facility. They abide by these design principles where they're trying to improve, as they design the facility, improve patient outcomes, improve patient satisfaction, improve worker comfort and safety. Their approach is, as you build something, make it good for the occupants and the specific, sort of attributes of that facility. And in this case, control of static to prevent some of these risks.